So we want to think about, as we listen to these different stories, we want to think about how we ourselves could apply what they're saying, what they're talking about, to our own work, to our own world, okay? And we'll hear about an approach adapted from advertising called social marketing of behavior, and maybe that helps us address questions of effectiveness that sound like, so what? How many people did something different because of your efforts? By Matt Myers, who's the Food Systems Internship Coordinator at the University of Vermont and a dialogue education consultant extraordinaire. He's bringing that expertise to our meetings here.
I'm about to tell you about a project I did 5 years ago.
Is that right?
That's it. Yeah. It was a 4-year social marketing campaign that was funded by NIOSH, and I partnered with the New York Center for Agricultural Medicine and Health, and together we put together, it was a year of research, and then we rolled out the program, and I'll tell you a little bit about it in the next 10 minutes. Okay, so Vermont Rebates for Robards program, you mentioned earlier, make sure people comprehend it and what it is, and that's not a sexy title, but when you're talking about farmers, what, I can get a rebate for Robard, they get that right in the first tagline. So you probably know tractor rollovers are the leading cause of death and serious injury for farmers. And we have a solution for that. So this roll bar over the seat is, your mother calling? This roll bar is 99% effective, and even if there's not a seatbelt used, it's still in the high 90s. So what do we do? How do we get farmers to put the roll bars over their tractors? So many of the farm tractors are, because tractors can have a life of 30 or 40 years, how do you get them to put a roll bar over the old 9N? So we decided to use a social marketing approach to this problem, and that's really the application of commercial marketing techniques as if you were going to sell a sneaker. What would the research be to sell a sneaker if you're Nike? You'd be looking at what the population is, and you'd be looking at what are the motivators for them to buy that particular sneaker, what the barriers would be, and you'd be doing a lot of focus groups. And that's what we did, but not to sell a sneaker like the commercial marketing would do, but we would use all those same techniques for social marketing and try to change a behavior. So in this case, the really targeted behavior that we were looking for was for them to call up a phone number, a hotline number, and for them to find out about, on that hotline, where they could get the roll bar for their tractor and how they could get a rebate. So that's really what we were looking for in a change of behavior. But we didn't know that we needed the hotline when we started out. So this is a quick run through. You're looking at what are the behaviors you want to change, who are your audience, what are the barriers they might be facing. And here it was clearly, I don't have the time to find the right roll bar, and I don't have the money to put it on. So those are two barriers. And then we tested images and text, and that's me sitting down in front of, I remember one point I was sitting with a bunch of people who'd been haying all afternoon. And I was like, these guys need a beer. I know they need a beer. So I went and got them some beer. They go, oh, okay, now I can relax. Okay, now we can do our focus group. But that was just needing to know who you're working with and what they need. And then taking a look at earned media. How do you create a story, put it on a platter, hand it to Fox News or to another news agency, and have them come out and give you free media, basically. So an example of that is, okay, I have a 7th generation Vermont farmer who's a woman whose kids are about to be of age to drive tractors, and I'll set up something in the back with the grandfather splitting firewood. They're there in a second because it's a homey story, but that's one of one of the many, many ways you can get earned media, and then assess your results. So how do you choose your target audience? In this case, we're looking at commodity groups, and which of the commodity groups are most ready to adopt this change. And we're going to use the stages of change model, which is really more of a model for public health. And then we're going to identify the most vulnerable commodity group by administering surveys. So this is the stages of change. Pre-contemplation, I have never thought about putting a roll bar on my tractor. And that guy did actually say, my father and my grandfather both died on a tractor rollover. But I'm not going to put one on. So pre-contemplation, contemplation, yeah, I've been thinking about that. And then preparation, yeah, I've been putting some money together. Yeah, I called the hotline, and I still use it even though I have to adjust my barn to get in and out of the barn. So this is, and so we did surveys about this, and so we're looking at, various commodity groups in Vermont, and none of them were past pre-contemplation. They were all there. So how do you decide? And so then you know the challenge too, because that means that you need to educate. If it was further down the line, you'd just be giving them the phone number right away. But first you have to move them down the stages of change. So which is the most vulnerable commodity group in Vermont? And the winner was vegetable and berry farmers, because they were the least likely to have at least one tractor on the farm that they could use that had protection with the roll bar. And they just didn't have a safe tractor. So we focused, became our target population, and this was the population we did all those focus groups with. So not all things go well from the start. We had a group in Boston that sent us up this image. They were giving us some images, and so this says retrofit, and you can see old hippies, right? And this went down so hard you would not believe it. The farmer's like, that is not us. This is us. We're modern people. We're not necessarily hippies in Vermont. That was the 70s. These images ended up being much more compelling. They want to see themselves in those images. So what do the farmers care about? And this is the messaging we're testing. You would think the farmer was most concerned about dying, but they're actually more concerned about not being able to work, which is amazing. So because it is this fellow says, I broke my ribs, couldn't work for months, almost lost my family farm, and I was one of the lucky ones. So this was one of the most effective marketing that people responded to. So they want to be able to continue working, and 1 in 7 farms that have a fatal rollover will be out of business within a year. I have 2 minutes left. So they're also concerned about protecting their kids. So those were the messages that we knew that we needed to roll out. So removing barriers to take action was also important. So we did create that hotline so they could identify the tractor roll bar and where to get it. I raised $220,000, insurance companies, banks, and others that had vested interests, so that we could defray the costs. And so if you don't remove the barriers, all the marketing in the world is not necessarily going to be effective. And then creating the earned media campaign, I had so many different outlets that I was pushing this information through. I mean, you couldn't walk around without hearing it on the radio, seeing it on TV, seeing it in the newsletters. All the various associations would send it out. I mean, there was just a blitz for 3 years. Oops, let me just go back. And then identifying the key lessons from that, and we did actually get the annual NIOSH award for that four-year campaign, because we did put hundreds of roll bars on the tractors. And what's great about this, and this is how I pitched it to the funders, was that you can do a lot of things that just evolve and then are no longer effective. But if you put a roll bar on a tractor, it's good for 40 years, and it doesn't require a behavior to protect you. So it was really, that was my pitch to the funders was, look, you're investing in 40 years of saving a farm, saving a farmer. So this does continue to go. We lost, the funding from NIOSH ended, but the hotline is still there, and we're still we can't give as many out because we don't have the funding. But that is it. So social marketing, I'm a big fan of it. It's amazingly effective.